Good morning, anatomy classes. Short lecture today, more admin stuff than anything else. Basically, what I want to help you with today is figuring out how to answer these questions on the assessment that I just posted a few minutes ago. Again, it's Wednesday morning, the 15th. This assessment is not due until Saturday, midday, around noon or so. You'll have to check exactly what the due time is, or due date is, and due time. I'm giving you the next 2-3 days to answer these questions for a reason. And the reason is I want to see some really good answers. I want you to spend some time. I don't want you to just blow through this, try to do it in 10 minutes. At this point, with everything that's going on, that's not the purpose. I really want you to get something out of this material. I want you to be able to apply this material. I want it to be beneficial to you. So make sure that if you have questions over the next few days, that you ask me. You send me an email, hey, Mr. Spano, I don't understand that question. But what I'm going to do right now is go through some of these questions. Not going to answer them for you, because that's kind of counterproductive. But I'm going to give you some hints and maybe some explanations that you might have, or questions that I anticipate you having. So let's look at the first question. The first question, I'm basically asking you to trace the path of an oxygen molecule as it goes through your body, from the time that you bring it in through your nose or through your mouth until the time it gets to a cell. So you have to think about those structures, and you need to look at the notes that are in Google Classroom to figure out the anatomy of the respiratory system. And the question itself, that would be, a trace would be good, but that's what I typically ask on the test. But I'm asking you to take it a step further. I'm asking you to talk about 3 diseases that would slow down that movement of that oxygen molecule from the point that it gets to your cell. How would it be stopped? How would it restrict its movement? And obviously with the diseases, or obviously with COVID, there's an issue with getting oxygen to the cells in the body. That's the prime issue with that disorder. So what I want you to do is think about some things that might stop the flow of oxygen. And I don't want you to just mention diseases by name. I want you to explain to me. Talk about, as oxygen passes through your body, gets to the point where it's exchanged in the lungs and then goes into the bloodstream, what would be some things that might slow it down? And what I would do, my advice for you, when you're answering this question, take a peek at the internet and look at some issues, or examples of oxygen transmission issues, or why does oxygen not get to the cells, respiratory issues. All those things will help you answer those questions. So there's a number of different ways you can answer this question. And again, if you have any other specific concerns, send me an email. The second question, why do we breathe? And I put in there specifically the answer to that question is so you won't die. I want you to talk about why you need oxygen. What is the body's need for oxygen? Why is it so important? Why do we spend time breathing? What is it so important for? So you need to kind of take a peek and think about what that's all about too, and I promise you we've talked about this. The third question, why does your heart rate and respiratory rate increase when you are exercising? Again, the answer is almost the same as to number 2. But again, I'm not going to tell you that answer. I want you to think about that and look it up yourself. So why do you breathe faster? Why does your heart beat faster? Why do you need more oxygen, I guess is the question. Number 4, describe the homeostatic relationship between the respiratory and cardiovascular systems. This is a question that would have been on the test if we had a written test. What is that relationship between these two systems? It's a very intimate relationship. Understanding the anatomy, what happens in the lungs, and why I've tied in this picture behind me here, the cardiovascular system and the respiratory system in one picture. This, in essence, is the answer to the question. You have to be able to explain it to me. You have to be able to explain to me the relationship between the respiratory and cardiovascular systems. What's happening here? And there's no correct answer. I don't have a rubric for this answer. I just want you to be able to tell me that there are two systems here working together, what they're doing. You can answer this question in 2 words, but that's not what I'm looking for. You're more than welcome to put those 2 words down in your answer, but I want you to explain to me what it means. All right, next question. there are two number fives. Number 5 for dental and number 5 for FEA. Number 5 for dental, I'll address that one first. You have a responsibility, and right now most dental offices are closed because of this virus. But when you get back to work, what is your responsibility to protect yourself and your patient from respiratory disorders? How would you do that? Why is it so important? I want you to read the question. I want you to think about that. I want to think about some of the precautions that you will need to take or you already plan to take to protect yourself and your patients. For FEA, you receive a call, you have a patient, this patient's experiencing respiratory distress, pre-existing conditions, and what is your job as you transport that patient to remove some of that distress, and B, protect yourself and your patient. So look at the question, make sure you read it, and answer as best as you can. Question number 5 for both classes, those are the ones I'm really going to be focusing on, because that's going to tell me that you understand why this chapter is important. Chapter 14, both for dental and for FEA. FEA, as I mentioned to you in class before we left, I said at some point when we get to the respiratory system, I said this months ago, this will be the chapter where we really tie everything together, and most of your calls as a EMS professional will be related to respiratory cardiovascular. They will. So this is a very important chapter for you, very important that you understand this material. So I'm expecting to see some detailed answers. I don't need a book. I don't need to spend half a day reading answers. But at the same time, I want to see some thought. I don't want to just see plug and chug from the internet. So do the best you can. Really go through this, spend some time. This is anatomy class. As much as it's difficult for even me to accept and for you guys to accept, this is going to be what we're going to have at least until the beginning of May. So in order for you to get the most out of this, you have to put a full amount of effort into it as best you can, and that involves getting in touch with me if you need to. And if you don't, that's fine. But at the same time, make sure that you do what you need to do to be successful. Have a good day.